Hi everyone, I'm Yalda. I wanted to do a presentation on hypertension. I feel that our team will benefit from having presentations like this and just regularly kind of filling in some gaps for our patients and also in the process kind of knowing how to best help our patients. So hypertension is very prominent all over the world. Roughly 1 billion people have it. So our concern is in US, so about 1 in every 3 individuals does have it. Um, and the statistic is highly skewed towards the elderly. Usually by the time people are 65 or older, 90% of patients have it. Having said that, we call these patients in their homes and talk to them daily. I just want to kind of raise a little bit of awareness on how to ask directed questions to help them best manage their condition. So what does it mean when someone has hypertension? So basically, blood is carried out throughout their body by different vessels from our heart. Each time the heart beats, it just pumps blood all throughout the body. So the force by which the blood is in these vessels, that's what the pressure is called. In a normal setting, there's no pressure, ideal situation, but hypertension is when the blood vessels throughout our body are experiencing persistently high pressure. Why do we get it? So 90% of hypertension, they're called essential hypertension. Basically, what that means is we don't know. So we don't know why we get it, and usually people start having high blood pressure at the age of 40 to 50. And then there are other 10% of secondary hypertension. It's basically we have another condition that is raising our pressure. We can have kidney problems, we can have sleep problems, weight can cause it. In pregnancy, a lot of people get hypertension, and some of the side effects of medication. But that one is a secondary cause leading to hypertension. But most people just get hypertension. What are some determinant facts, or what determines if someone gets hypertension or not? So the biggest one is age. Almost everyone, when they get older, they have hypertension. Uh, and then other things that can take place is genetics, so it can run in families. Certain races have more likelihood of hypertension over the other, and also being a female versus being a male. Usually younger than 50 patients who are males have hypertension and over 50 females have hypertension, but the numbers are actually quite close, female versus male. So again, this is where our services come, and why I believe it's such a great service is why it's important. So up to we're still losing about 60,000 people yearly in the U.S. due to high blood pressure, and this is known as silent killer. And it is silent killer because there's no symptoms. People feel okay, or they have adapted to their new normal um, until there's significant damage to their heart. It, they can have sudden heart attack, they can have stroke, heart failure, various of different kidney diseases or eye disease. By that time, it's very hard to prevent them from getting the consequences. So it's really the only way people will know they have hypertension is to monitor it. So it becomes really important. We have to communicate that with our patients who are feeling fine and kind of neglect that. So the slides that have this little heart are the slides that I want you to take away from this lecture. Basically, patient education, how they should take blood pressure. They should avoid coffee or alcohol 30 minutes before taking their blood pressure. They should sit upright for 5 minutes without talking, and then just be in a very relaxed state when they take their pressure. Their legs should not be crossed, and if possible, their back has to be supported. And one other important thing that you have to point out is that the pressure cuff, whether it's in their arm or their wrist, it has to be at the heart's position to get the most accurate reading. And for us calling them, we should be aware that the wrist cuffs, they overestimate by a little bit. It's less accurate, and the pressure readings that we get are a little bit higher than what they normally have. So it's just good to be mindful of that. Okay, so what do the numbers mean? So basically, there's two numbers, systolic over diastolic. Systolic is when the heart's pushing, and the diastolic is when the heart is in a relaxed state. Before we thought diastolic is more important. Now we think systolic, but both of them are really important. We don't want the heart to work harder than it should, and normally we want to keep it 120 to 80. It's considered elevated, but it's called pre-hypertension when it's 120 to 130, but the diastolic is less than 80. So stepwise, if we go up, then we get hypertension, and then we get stage 1 and stage 2. And with the remote blood pressure monitoring, we actually have a breakdown of stage 1 and stage 2 and an average. So it's really good to keep a note of the stage 2 hypertension, because we can see how many of the readings are stage 2 versus stage 1, in addition to the average, so we're aware where they stand. So what symptoms do they have when they have high blood pressure versus low blood pressure? So headache is a common one, and we ask almost every patient who has high blood pressure if they have headache. And the reason we ask that is because we have a lot of blood vessels in our brain, and when the pressure is high, that some of these vessels are very fragile, so it can actually tear those blood vessels, and that's how stroke happens. And the number one risk factor for stroke is actually high blood pressure. So that's our biggest thing that we worry about, and we will take actions, send them to clinic or emergency, or just be aware, because the consequences far greater than you need to take the precautionary measures. But other things they can experience, they can just have fatigue, and they can communicate that with you, but confusion, they can't really communicate that. But then other ones, difficulty breathing, vision problems, irregular heartbeat, or blood in the urine. So it's really important to know these symptoms and to make a note of them once we talk to them if they have high blood pressure. On the other end of the spectrum is low blood pressure. So again, fatigue, lightheadedness, dizziness, nausea, depression, loss of consciousness, and blurry vision. So those all can go with the lower blood pressure. So again, if it's very low, we are concerned. But if it's a little bit low, we're not as concerned. A lot of times they might be very dehydrated, so we can encourage them to drink water. But it's good to be aware of these two symptoms when you're talking to patients. So how can I best help my patients? So basically what the physician does is they sit back and they want to help their patients, but they also don't want to give them medication if they don't need it. So they think actually in a stepwise manner. First, they think how bad their hypertension is. Can they do it with diet, exercise, and education alone, or should they give the medication? So that's something that happens before we actually open up the charts and read about our patients. So that's not our judgment. So at that time, we know they're either in medication or not. If they're not in medication, this becomes very important to encourage them to have a right diet, exercise, and then just to educate them about all the stuff about hypertension, what symptoms to watch for, so on and so forth. Once we see that they're in any kind of medication, we have to ask and be aware if they're experiencing these side effects, because there are different brands, and some of them are covered by insurance, some of them are not. So basically, the doctor makes a judgment based on what's the best thing for the patient. But if they're experiencing side effects, they can switch it to a different family of these drugs that do the same thing. So it's our job to kind of be aware of that, and if we see some patients are experiencing certain symptoms, then to advise them. That could be due to their medication, and to discuss it with their doctor. So some blood pressure medication give you cough, some give you diarrhea, constipation, just feeling nervous, feeling tired, feeling drowsy, lack of energy, having headaches, nausea, or vomiting. So it's really important for us to be aware of these side effects. When we're talking and conversing with our patients, we can kind of put the big picture together for them and advise them to seek the help or change their medication or educate them. So those are the side effects to watch out for. So now we talked about some determinants of health, which we have no control over, but these are the risk factors. So people who have high blood pressure tend to have these things also. So one is their diet, very high in salt. Second thing is obesity. Third is they have a very sedentary lifestyle. Fourth is alcoholism. And then the last one is their socioeconomic status, which leads to the overall stress. So again, another slide with a hard debate, what are our goals? So we almost always tell patients to have less salt intake, but how much is advised? So this is by American Heart Association. These are the recommendations which I'll go through. So salt recommendation is about 1,500 milligrams daily, which is equivalent to 3/4 of teaspoons of salt daily. So that's not a lot. You can educate them. And while doing that, let them know that canned foods, even though they don't taste salty, they have a lot of preservatives, and that's kind of, if they read labels, they will be aware of how much salt is in them. So tell them to avoid canned foods and also to stick and read labels and just be very aware of the fact that they cannot consume more than 3/4 of a teaspoon. So that's the recommendation. The second thing is the obesity problem. So basically, how we know someone is carrying more weight. If they carry more weight, basically your heart's working harder than it should, and it's putting a strain on your heart and your blood vessels when you're getting high blood pressure. By reducing your weight, you will prevent that problem from happening. But the way we can educate this with the patient is to calculate their BMI. So we can just get any kind of online BMI calculator and ask them about their weight, ask them about their height, plug it in, and they'll give us an arbitrary number. But our goal is to have our patient in normal weight range. From my experience, when I'm talking to a patient, I do that, and a lot of them are in overweight, slightly overweight. So I encourage them, I tell them exact directed goals. Oh, you should lose the next 4 weeks, you should lose this many pounds. If you will benefit, and I'll encourage them. And basically, if you calculate their BMI and you discuss it and you come up with a plan, they're more likely to follow through. So you encourage almost every patient with high blood pressure to lose a few pounds. Another thing is alcohol. So how much alcohol? So daily 2 units for female and 3 units for male. So then you can, depending on some like hard liquors, they are more units per volume than say wine or beer and stuff like that. So you can just look it up to see what units or 2 units. You can ask the patient what they drink, how often they drink, and kind of check with them, and then educate them how much is right and how much is excessive, and how it leads to their blood pressure reading. And the final thing is exercise. I think the biggest thing with that is we need to encourage them to stay active as they can. But what we recommend is about 90 to 120 minutes of exercise, like jogging or fast walking on a weekly basis. Okay, so that's all for hypertension. If you have any questions, just message me and I'll try my best to answer. But thank you so much for taking the time to hear about this. And yeah, thank you.